So Joan, you are well known in the community and you had an illustrious career in public service. Can you tell us a little bit about that?
Well, I started out as a school teacher. Then when I retired from that, I became the New York State Assembly member for this district, which is downtown Brooklyn, Cobble Hill, Carroll Gardens. Right. And I did that for 17 years in the New York State Assembly.
And what attracted you to join our board?
Well, when I first moved to Brooklyn Heights, I spent some time as a candy striper at the hospital that was across the street from Cobble Hill.
Sure.
And very often, patients would be brought from Cobble Hill to Long Island College Hospital, and they came in terrible shape.
Congress Nursing Home used to exist where we are, used to be the original entity, and the then owners were actually kicked out, and there was a whole court case. And Cobble Hill Health Center, a non-profit, was formed.
It became the institution that I know it today, and what a difference it was. But I really thought, I'm going to try to be on a board where I can make a meaningful contribution. Mm-hmm. I was impressed by, first, the quality of the people that were currently on the board, you know, and how much care they exhibited, always striving to do more to service the people that were there to the best of their ability. And so that struck me as, that's the kind of board I want to be on. Not only do I feel my role is meaningful, but I've learned a lot from the others. And that's important to me too, to always learn and grow as well. I mean, we have this wonderful dog program, right?
Yes.
I didn't know anything about that, where people in the community
Pet
are
therapy.
Encouraged to bring their pets into the institution, which is offers such a measure of pleasure to the residents. Like the contest we have with the local students.
Yes, the writing contest.
Yes, and the students, they're enthralled, and the committee of seniors, they read it, they discuss it, they think they've made the best choices for the winners.
Totally true.
You know, there's always another link between the center itself and the community and the things that the community brings in.
And you know, we're strong believers that we want folks to age in place, live in their homes as long as they possibly can. But sometimes, you know, the care that's needed is more than can be managed in the home. What advice would you give somebody who's struggling with that?
Often a person's in a hospital situation, say, and they're shown these lovely photographs of what a beautiful facility looks like, but it doesn't talk to the kind of care and compassion that somebody needs, whether it's a short-term stay or a long-term stay.
Right.
And people should take more time and evaluate what the nursing home is about, what kind of services they've provided, and how much of the community they bring in.
So Joan, you are not only a board member, but you're a board member who was actually a patient.
I had surgery at Maimonides Hospital, and I couldn't be released home because I couldn't take care of myself. And they said, here are a list of facilities that you can go to.
Right.
So Cobble Hill was on the list, and I thought, well, that's in the community in which I live, which frankly would make it easier for my friends and family to visit me.
Right.
And I arrived in a wheelchair. I had so many limitations. It was very difficult. The rehab people were absolutely amazing. I had physical and occupational therapy every single day. And when I wasn't strong enough to actually go into the rehab facility, they would do the physical therapy in the room with me and then help me walk in the hall. And so when I left in a walker, I was mobile. And then I was entitled to services at home through Cobble Hill.
Through your choice at home, at our home care agency.
And I had a visiting nurse, I had an occupational therapist, and a home health care aide 3 times a week. And they were invaluable into my recuperation. I'm back 100%. And anybody asks me about my experiences, I tell them about the care and the attention and also the expertise. Cobble Hill knows what its mission is, right?
That's right.
For the rehab people, it's to get them back on their feet and functioning to the best that they can be.
You know, our goal is to improve quality of life. Wherever they can have the highest level of quality, that's where we want them to be. We want to help them get there.